Uh, this is the Word is Hour, and I'm the host, Michelle Padilla, and I got Sandra on the call today, and we're going to be chatting it up a little bit today. So, Sandra, how are you enjoying this weather today?
The weather was great today, Michelle. How was it for you?
It's cooling down. I mean, we have a little, humidity, which is fine, and so I like it. So it's
Well,
called,
that's good.
So I don't know. I think this is going to be just the two of us, which is cool.
Which is cool. I'm cool with that. I mean, I hope some other people do choose to join us. I hope we might have some stragglers. Did you set it up to where we're recording?
I did. I hit the recording, so we're all good. This time I remember to record. And I just
Awesome.
talked to Sigrid. She goes, "What is a podcast that she's talking about?"
Well, my understanding of a podcast is that it's just an opportunity for people to hang out and talk about different topics that
Yep,
are interesting and important to them,
right. So I'm
right?
going to make this bigger so I can see. There we go.
All right,
Oh.
sorry, the TV's on behind me. Let me just step
So what
away.
I'm going to do is I'm going to take a little picture. I always post it to my social media. Hope you don't mind.
No worries. I'm getting my smoothie because you got to be healthy.
So smile. Yeah,
Okay, wait, let me turn off. Okay, no glare.
there we go. And then sometimes what I do is I post it on Facebook, but I don't know if you feel comfortable with Facebook Live, so I let you be the call with that one.
I'm fine with wherever you wanna
All right.
post that. I'm
All
good.
right, let's do it. So we're gonna do this.
Okay.
So we're trying to get this live.
I'm
Facebook.
gonna sit here and I'm gonna be healthy. I have my berries and oats and almond milk smoothie with
Ooh.
a little bit of some protein drink because I'm allergic to dairy. So I always do almond milk and I always do Evolve, which is like a plant-based version of Ensure. For those people who
Nice.
drink Ensure, if you're allergic to dairy, you can drink something like Evolve and it's plant-based and dairy-free.
Okay, I think I have you. Aha, yes. You're on my Facebook. Woo!
Yay! I'll have to check that out a little bit later. I can't have multiple programs on at the same time. So hopefully,
I
um,
gotta charge this up as well because sometimes when you're doing a podcast, it eats up your battery.
yeah, it looks like David may have forgotten to send out reminders to folks,
Oh,
but
that's cool.
a lot of people also tend to use the call-in number. So hopefully there are people using the call-in number.
If not, we'll figure it out.
Yeah.
All right. Hi guys, this is the host Michelle Padilla. I'm the host of the Awareness Show, and I got Sandra on Zoom. We're doing a podcast today, and so this is the second interview that I have this week. I have another one tomorrow, and then I have another one on Thursday. So the Awareness Show is picking up a lot of guests, a lot of uh, good conversations to have on the show. We're going to be talking about education. We're going to be talking about disability. It's going to be a lot of fun on the show. And we want to make sure you guys know what kind of resources are there available to those who are struggling and who need the support. And Sandra is going to help me on that subject. So we're going to, right now we're dealing with the weather and the COVID-19, and we're going to have another topic pretty soon on that. We're going to be discussing about the COVID-19 and how you guys can get the resources available to you guys. I met Sandra, I think, was it last year at the regional rec? Was it last year, Sandra?
I think so at the Regional Advisory Committee meeting.
Yep. So, Sandra, tell me what you do. What is your occupation and what do you do?
Well, I do a lot of different things, Michelle. That's a really big question. In my day job, I work as an educational consultant, which means that I help families that have
Somebody's calling in.
special education. Yeah, you're in control, so you can allow them to start their video. Looks like.
Okay. Hi, who's this?
Hi, Sandra. It's me.
Hey, Wesley.
Hi, Wesley.
I've asked a couple of exciting participants to join us that do similar things to what I do.
Yeah.
Wesley Weatherspoon is.
I guess you'll get the camera on me.
You have to just click a little button that looks like a camera. It looks like a video camera at the bottom of the screen. It says start video.
I totally forgot about the teleconference. I just found out right now.
Oh,
That's
good.
what happened yesterday. How racked me.
Awesome. All right, so click start video at the bottom of your screen and we'll be able to see you, Wesley.
I'll give him a few minutes. So Sandra, tell me what you were doing.
So yeah, we got a little bit distracted with Wesley. Wesley's kind of cool. He does some similar things to what I do. I help families that have children in special education, so to deal with the schools when they need somebody to come in as a professional advocate. I do that because I have a master's and a PhD in special education. I also have a master's in public health, which means that I've worked with a lot of groups that have chronic diseases and chronic illnesses. So not just developmental disabilities, but other disabilities also, like spinal cord injury and HIV, and, you know, ALS. I've worked with a lot of disability groups, people who have had strokes. And, you know, so I get to do a lot of community work. I've worked for regional centers before. I've worked for United Cerebral Palsy before. I've worked for the American Stroke Foundation. So I've worked for a lot of different agencies that help people with disabilities. Wesley, my friend who is currently on the line, I hope we haven't lost him, is the community advocate at the USC, University Center of Excellence in Developmental Disabilities out of Children's Hospital, Los Angeles. I've also asked my friend Keisha Weller, who is the community advocate at the UCLA Tarzan Center, which is the University Center of Excellence in Developmental Disabilities there, to join us as well on our podcast today. Hopefully in the future, you'll be able to connect with them and have them help plug people into resources. We all kind of work as a team. In my spare time, I volunteer with the State Council on Developmental Disabilities. I also volunteer with the American Red Cross. So
that's the fan.
Oh, yeah, we were talking about what Sandra does. And so, Sandra, I don't know if you know this, but there's over 7,000 rare diseases today.
Yes.
And one of them, I mentioned it to you about too long ago, is called 22q11. It's actually, there's several names involved. There's DeGeorge, there's cardiofacial. It's not all just one name, but we're trying to keep it to one name. So because of that, what it is a tiny piece of a chromosome, missing piece of a chromosome. So it has over 200 symptoms. And each person who has 22q11 is different. So you have congenital heart failure, you have, teeth issues, visual problems, you know, all this stuff going on, schizophrenia, you know, so and then a lot of people don't know what it is. So my goal was to inform you guys what 22q is, and that's how I started this podcast a long time ago, is to get the word out. So here I am trying to get resources for people who have learning disabilities, because I struggle myself. Like I was telling you, there's other people who struggle and have a hard time getting the resources available to them, and they don't know where to turn. So now it's my turn to give back to the community, and I hope that you guys can help me give back to the community.
That sounds great, Michelle. I also have what is considered to be a rare disease. It's called Sturge-Weber syndrome, and it's made up of a bunch of different disabilities. One of them is cerebral palsy, another one is epilepsy. I also have glaucoma, and so I deal with vision issues. I have hemangiomas, which are basically little tumors of your red blood cells that causes them to overgrow. And so it causes a very large birthmark over most of your body. And when you bleed a lot. So it's kind of a little bit of a bleeding issue as well. And I too struggle with learning disabilities. So that's part of the reason why I ended up going into the allied health professions. And part of the reason why I do the kind of volunteer work that I do now. Right at the Red Cross, I get to talk to people about how do we make programs that help people with disabilities evacuate if they need to evacuate during an emergency, or get resources if they need them.
Right.
If things happen like a house fire or like COVID-19, a lot of people have been needing groceries and food and different sorts of things. So I get to do that when I work with the Red Cross. And then, of course, my work up at the state council, just like your work on the local level, looks at what is it that people are finding are some of the biggest challenges in society, and
Right.
how do we address those through education, through information, through creating changes in the way systems work, so that systems really work for people that need those systems.
Yeah, I agree. And it is like me, and I have a couple of friends online right now. Maureen has a hard time finding resources. And, because here in California, we got a lot of resources available to us, but other people at our states, they don't have the luxury or the resources available to them. They have very limited resources. My friend from New York, they don't have a regional center out there. I did not know that.
No, regional centers only exist in the state of California. We're very lucky in California. Regional centers were designed in the late 60s to basically help people address problems that are specific to people with developmental disabilities.
Yep.
That would be autism, epilepsy, intellectual disability. I know I'm missing some.
There's a whole bunch. Yeah.
There's like 4 major categories. I should know this because I used to work for them and I used to sit on their board.
Well, actually, now there's 6 of them.
Well, there's 4 categories.
Right.
Autism, epilepsy, intellectual disability, and cerebral palsy are the 4 major categories. Then there's a 5th category, and that 5th category says that basically anyone who needs services and supports similar to all the other 4 categories qualifies for services. So you can have a diagnosis like 22q and have needs very similar to someone with intellectual disability or someone with cerebral palsy and still qualify for services. You
Right.
can have Down syndrome and have similar needs like speech therapy, occupational therapy, physical therapy, special education, and still have a variety of symptoms that don't get addressed through our national or through what we call the federal system.
Yes.
Right, those agencies like Department of Rehab and
We got a raised hand. Who's got the raised hand going on?
Sorry, it's Ruben. I just joined.
Hi, Ruben.
Hi, Ruben.
This is my co-host, Ruben Garcia. Why am I going to call you Ruben Padilla? I have no idea.
Hi, pleasure to meet you. Sorry for the nappy hair.
No worries. Thank you so much.
He is my co-host. He's my engineer guy. If you need a computer fixed, he's the one to come and ask for computer support. So he's been with me for 8 years.
Is that how long it's been?
Wow.
Gee, thanks.
Like, that's how long it's been?
See, we kid like that a lot on the show, so don't mind us.
You have a lot of fun. It makes it seem like it goes by fast, right?
It really
Oh
does.
yeah.
I haven't even counted the years. That's how long. I have to check my LinkedIn, but then again, I'm never really on.
So Ruben, Sandra, I met Sandra on the board of the regional center, and so she's been like coaching me about different higher up state the policies and stuff like that. And so she works with disability. She's also an attorney for disability as well.
Mm,
And so we're trying to make sure people get the resources available to those who are struggling that don't have the resources.
absolutely, because right now, everybody's in need, but even more so, the folks with special needs are in more of need now more than ever.
And Ruben also is a teacher. He's a special needs teacher. He teaches as well.
Well,
So,
I've taken a little bit of a hiatus, but yes, I do have experience in public school and also working with special needs students. I did for several years before I started my business.
Very cool.
so,
We need more special ed teachers.
oh,
It's really hard. We're having a lot of families that are having a lot of struggles right now because their students aren't getting the services that they usually get when they're in school. Now that everything is closed, right? We have a shutdown. And so students aren't quite getting all of the specialized help that they normally get in the schools. And mom and dad are having to do that at home, and it's really, really a challenge. We actually have a question from one of our participants, and it was really about kind of how Ventura County has really low numbers of COVID-19
Hmm.
cases compared to other counties.
Yes.
We've been very fortunate. I am lucky enough to have worked with the County Department of Public Health many, many years ago when I was in school. I did my graduate internship with them, and I know our director of public health, and he has taken some pretty strong measures in our county. He shut things down early, and he has kept them shut down, and he is really making sure that folks stay home, stay indoors, follow the rules and regulations, get tested when they need to get tested, call their doctors if they feel sick, and let the healthcare professionals really address what people in our community are needing. And because of that, we've been lucky enough to have very few cases, right? Because
right.
people aren't out in the community spending time together, talking to each other. Now, that being said, there's still a lot to do. There's a lot to do everywhere.
Right.
We have
Well,
been really lucky. So,
Ruben, he's from South Bay. He's from LA. He takes buses a lot and he takes the trains a lot. So Ruben was telling me that they clean.
Oh yeah. So I'm
Yeah.
actually from South LA. So it's actually about 15 minutes from Carson,
got
give or
it.
take. And what I was telling Michelle, because I will say, our public transportation system has never been the most tidy. If anything, it's very neglected for the most part. Ever since this all happened, they've really buckled down on that, where the elevators have been clean, the staircases. Literally, if you took the train in the afternoon and came back during peak hours, they're different colors. When I took off, it was like black, and when I come back, it's like cement color. It's
Right.
like they're really buckling down. There'll be a guy just in a suit spraying everything down. So they're really buckling down on it, and which I'm happy about, because that was always one of the biggest issues in public transportation, is that stuff was just not clean. Because there's so many people, there's so many hands. And then people, certain living situations. Especially with our homeless situation. Sometimes the homeless will come in and shelter inside of the train, which was understandable. But with the conditions that we have right now, it's just not ideal.
And you've heard in LA, we've had a whole bunch of homeless people, not as bad as out here in Ventura, but more so in LA. They make a big deal about it because there's a lot of homeless out there. And that's one of the things they were talking about. What if somebody had a COVID-19? Where do they go?
Well, this
So
is
That's a challenge for every community, Michelle. That's it's a problem here in Ventura County. We don't realize it, but we actually, for as small as our county is, we have a pretty large homeless population. And we've been really doing a lot of outreach through a bunch of different groups to our homeless population to see how we can help them, get them into shelters, get them into locations where they can isolate, because it's kind of hard when you're out on the streets to shelter at home if you don't
yeah,
have somewhere to
and also
shelter.
just
So that's another reason why our cases are pretty low, is that we've been doing a lot of outreach to a lot of groups like our farm workers who don't necessarily always have a way to be safe and to be healthy. We're making sure that we're working. I was just in a meeting with our Medi-Cal Managed Care Commission for the county yesterday, where we were talking about what are some things that we're doing to make sure that people with developmental and intellectual disabilities, regional center clients, and people who have disabilities that don't qualify for the regional center but also get special ed, which is a lot of our folks in the state. We're making sure that those folks have access to Medi-Cal and to resources and to calling doctors and telehealth services as much as possible. If you get Medi-Cal or Medicare in this county, we're making a real big effort to make sure that those people get the services and supports that they're needing to get through this crisis. But also, just some of the basic things, like you said, Ruben, if public transportation isn't clean, that's not healthy for folks, right? So
right.
things like washing your hands when you get onto paratransit, or washing your hands immediately when you get off of paratransit, or taking your shoes off before you walk inside your house. Just some basic things like that that help you kind of stay, keeping your hands clean is like one of the things throughout the world that helps people stay
Yeah,
clean.
because I think when I was reading online, there are two cities now, actually three or four. I think I was telling Sandra, but Ruben, you haven't heard about this one.
which one?
It's Orange County. Orange County is the highest one right now.
Oh yeah, and I think part of that has to do with the whole beach incident.
Yes,
Because everybody started going to the beaches, so then the numbers rose because then everybody was exposed.
right. And then you have, I think the second most part is Torrance now, Ruben. 242 cases in Torrance,
It's so small.
right? And then
Crazy.
Lawrence is a pretty small city, so that's a lot of cases to have.
and then Carson has, what is it? Somebody posted 220 cases in Carson.
Oh man.
And
That's
Carson, they just announced on Carson as of yesterday, they're going to have a free testing site over at Harvard UCLA Medical Center.
right.
Wow.
So,
Well, the stats as of 3:30 p.m. today. Today's the 28th, right?
yeah,
For Ventura County, our total cases right now are 508. We have 5 new cases as of today. We have 356 recovered cases. We have 26 current hospitalizations. 11 people are currently in the ICU throughout the county. We have 4 hospitals, and they're spread across those 4 hospitals. We have 135 cases in active quarantine and 17 deaths. But we've only tested 9,528 people. So that's not very many people that we've tested. Just in Thousand Oaks only, we have more than like 50,000 people living in that city. So 9,000 is
how many in Port Hueneme?
many. I don't know in Port Hueneme, but I do know, I can tell you the number of cases that we have found in Port Hueneme. There are 11 cases in Port Hueneme. There are 116 in Oxnard.
Whoa, it went up.
In Thousand Oaks, there are 89 there. There are 36 in Ventura. 27 in Moore Park, and 44 in Camarillo. Those
Wow.
are the places with our highest numbers for the county. And actually, it's people mostly between the ages of 45 and 64 that make up the highest number of cases that we have.
Yeah.
96 females in that age and 108 males in that age.
We just got a message. Most of the deaths in California are from Latinx community. Saw it in New York Times. He lost local to COVID-19. What was beginning to do? What is being done to help disparities in Black and Brown communities?
Well,
That's
I do want to elaborate on that because I will say that communities of color or low income communities have less accessibility to these things. Because I have yet to see these resources come to lower income communities like Compton and Watts and other communities of color as well. So I think that's also where there's kind of an indiscrepancy going on, because that's why according to some of the statistics that this has been even most impactful to people of color.
Well, I think there are a couple of reasons why people of color are really experiencing a lot of disparities. In general, people of color experience health disparities across the board, whether that's in terms of access to primary care, in terms of access to emergency care, in terms of access to specialized care, right? We find that they don't go to places like heart doctors or hip surgeons or specific doctors that treat specific symptoms. So we tend to see that people that come from Black and Brown communities have a hard time getting health care. And it's not that they couldn't have access, it's that we don't really make it a point of letting our system reach out and into those communities to let people know that these services are available for them and how they're available for them. People in those communities usually have to go and seek out the care that they need, as opposed to other communities that tend to have higher levels of education. They also tend to have higher levels of access because they freely can get access to the information that they need in order to be able to get some of the services that they need. And that's part of the reason why we're setting up our social services in such a way during this time. And, during any emergency, we try to really reach out to groups that we know don't easily get access to services. But, we would like to see those groups getting access all the time, not just
right.
now because it's an emergency, but in Ventura County. And I don't know about LA County because I don't have that direct contact with the directors at County Public Health for LA. I used to have friends that worked there. I used to be friends with Dr. Levin, who ran the CDC during Obama's administration. And so I knew a little bit more about what was going on in LA County at that point. But it's my understanding that most county health departments like ours are making it a special point to put together teams to go out and find folks that don't typically have access to healthcare services, and taking those services out to them so that they do have opportunities for things like, I don't feel well, these are my symptoms. Oh,
Right.
You might need a COVID-19 test. Oh, no, you need this. Why don't we set you up with this clinic over here? They'll
Right.
be able to help you with this particular issue. So in a sad way, we're able to get healthcare out to more people today than we have in the past because there's so many barriers in the system.
And the thing is like I was telling Ruben, I had been sick for a while now. I've had sinus problems, and so the thing that they told me is to drink antibiotic, or not the antibiotics, but the pro antibiotics, and that will help with your immune system. It will help, and drinking tea will help you. Also, washing your hands, and right now, especially right now, I'm going to say this because we are dealing with the Santa Ana winds. So for people who have sinus issues really, really bad, that's going to trigger their sinuses really bad. And if they have some of the symptoms, then the doctor is going to suggest taking the COVID-19 test to make sure you don't have the virus because they are similar. You get the you get the chills, you get the runny nose, you get the you know watery eyes, and it's not and some people do get fevers.
Okay, so let's back it up and clarify a few things, right?
Okay.
So the virus is not really similar to a sinus infection.
No.
You can have some similar symptoms.
Right.
Right? The virus is kind of very different. It's a respiratory infection. So in that sense, it will affect things like your nasal passages, your sinuses, your eyes, your throat. It will cause fever. In some instances, some of the different types of symptoms that we haven't been looking out for are neurological. So if you have cerebral palsy or epilepsy and you're having things like seizures or, spinal issues, those could be warning signs that you might have the virus because the virus can affect you in that way.
Yeah.
Gastrointestinal issues are also pretty uncommon symptoms. So like if you've got the grumblies in your tumblies and, you can't seem to keep anything down and, it's not feeling very good, that might be another potential symptom,
Yeah.
right? We're not really sure what all the symptoms are. We're finding new symptoms from the virus all the time. So it's probably a good idea to either call a local clinic or call your personal care your primary care physician to really just kind of double check, could this be just a regular stomach flu or should I get a test? Usually fever is going to accompany you with the virus, right?
Right. Also, we have one of our callers says shortness of breath, dry cough, and fever, sometimes diarrhea and chills and strong headaches. That is why we have the toilet paper. Come on, Ruben. I know you want to make a comment. Come on. I see you laughing.
I'm just laughing about the toilet paper.
Well, yeah, I mean, I think the toilet paper is kind of a secondary issue, right? I think we want to make sure that we primarily have the more important things that we need in our house. Things like Lysol and disinfectant to wipe our counters with. Things like soap and water to keep our hands clean with. Make your own masks. I have a mask here that
enough.
my future mother-in-law just made me and sent me a mask.
Hey, we should all have our mask on.
Actually, we're not in the same room, so we don't need to, but if you want to demonstrate, that's awesome.
Come on, everybody put their mask on.
All right.
All right, we're doing this with masks now.
Told you I look like a pirate.
I like Ruben.
Everybody has their mask on.
Yeah, mine keeps falling off. Sorry, guys.
So, Mom says I look like I'm robbing a bank of mine. So, which is cool.
Yeah, mine is red hot chili peppers.
Ruben's gonna have his on pretty soon. So he just got his and he's playing with it. The only problem is with glasses, it's kind of hard. You know what I mean?
Well, I find the trick to be that if you put your glasses on after.
Yep.
Oh, now you tell me. Where's your mask, Ruben?
Oh, well, hold on. So I'm trying to show people the best thing to do when you put, because I wear glasses all the time. Like I'm all sweaty from the glasses. And my glasses are pretty big. I'm pretty dang blind, so. So the first thing you want to do is put your mask on. Mine's a little bit different in design, but still, I mean, it still has ear loops. So mine has extra support. It actually Velcros to the back of my neck, so it doesn't fall no matter what I do.
That's a good thing.
And so I usually put my glasses on after, because then my glasses will pass the loops, and then my glasses will also tuck above my mask. So if you see, it'll push into my mask versus through my mask.
Yeah.
Because you want to avoid any kind of like pocket per se or opening, because then it defeats the purpose that you can do for that.
Yeah, you want to try
Oh,
and keep the mask sealed. It's a good idea to, wear a mask when you're exercising, when you're out walking. Mine actually has a little pocket on the inside so that I can stick a coffee filter or a HEPA filter in it
Nice.
so that I can have a filter in my
hey
mask.
guys, we got 10 minutes left. I just got a message from Zoom.
Okay, so
I did have a quick question. Hold on. Where in Ventura County can you buy essentials?
Well, there are a lot of places in Ventura County where you can buy essentials. Grocery stores are still open. Many of them are doing delivery. Target is still open and they're also doing delivery. CVS is open and they can get you, if you don't get your prescriptions through CVS, they can do home delivery if you do. And they can also have you order online so you can go into their app and have your prescriptions listed, and then you can add items that you need and they will also deliver those to your home. If you need any assistance in being able to get essentials, you can
Okay.
call the Red Cross. The Red Cross does have teams that are able to help you do that and drop things off on your doorsteps.
And then we have the
The
next question. I wear a mask when I exercise and hot. Can't find any mask. He can't. He can't find
Yeah,
any mask right now.
it's at this point, all of the masks that are for sale are pretty much being taken up by healthcare workers and doctors and medical providers. At this point, it's probably best to not try to buy masks.
Right.
You want to make sure that we leave those masks to our essential workers because they do need them. They're working in the hospitals, in the clinics. They're providing essential care. They're nurses, they're home health aides, they're doctors. My significant other is a doctor, works in a lab and uses some of that protective gear as well. So we want to
Oh,
make sure that we leave that for them.
right.
There are a lot of videos on YouTube that will show you how to make your own mask. There's a great CNN.
Well, we could
CNN
put these in the comments, so we're running out of time. But Ruben, before you go, tell people what you do so you can get your business up and running.
Oh, sure. So I do tech services. So if you guys need help setting up Zoom or whatever the case may be, if you're having computer issues, if your computer decides to fall apart on you while you're working from home, I'm more than happy to help you guys out. My company name is Music Man Engineering. You can find me on Facebook, on Instagram, on Google. And then I just did want to mention very shortly, if you have an essential business or you're an essential worker, I unfortunately still have to do house calls sometimes and still um, make sure to enforce social distancing and so on and so forth. But if you do happen to have the kind of work where you have to be outside or you still have to go to somebody's home, to invest in a good mask, like for example, mine is not only stylish but also has it also has replaceable filters, and these are N95 rated filters. So they do come with replaceable filters, and also because again, if you're gonna be out and about almost every other day or 3 times a day, you do need a mask that will hold up to the wear and tear of being out and about, because you sweat in this thing and all kinds of other things. So it's just something to look into if you have that kind of work, if you're an essential worker.
Sandra, real quick, how do they find you? Instagram, Facebook?
Well, most people can find me through the State Council on Developmental Disabilities. If you just reach out to them, they can get in touch with me and I can hit people back. People can find me through you. I don't make a whole lot of my stuff public, but Michelle, you know how to get a hold of me. And so
Yep.
if you make referrals, I am more than happy to get back to people and continue the conversation about what resources there are locally. And like I said, I work with folks like Wesley over at USC and Keisha over at UCLA. So we tend to do stuff not only at the state level, but also at the national level. So if folks out of state have questions and want to get in touch with resources in their own state about things that they are needing as an individual with a developmental or acquired disability, they
Right.
can get in touch with any one of the three of us, and we will be more than happy to make the appropriate referrals.
Thank you guys for stopping by. This is Michelle Padilla, the host of The Word Show, my co-host Ruben, and I will get this podcast up and running as soon as I can. So I'm going to save it now that I know how to save it and I know how to convert it. So it'll be up in a little bit. So I'll see you guys in a little while. I'll see you tomorrow, Sandra, and I'll talk to you later, Ruben. Nice chatting with you, Wesley.
Have a good night, everybody.
You too.
Meeting everyone.
Bye.